Hi, my name is Dr. Jennifer Boevers. I work at the Family Practice Clinic at Palo Alto County Hospital. My subject today is diabetes. Welcome to Living Well. I have lots of individuals in my practice who have diabetes. Diabetes is a chronic condition in which the body has difficulty controlling the amount of glucose, which is a sugar in our blood. Glucose is needed in our body in order to help produce energy, but having too much sugar will cause some problems. The amount of glucose is controlled in our blood by a hormone called insulin, which is produced in our pancreas. In diabetes, there is either a problem with not producing enough insulin or else there's enough insulin around but the body is not able to utilize it correctly. So there's two different types of diabetes. There's insulin-dependent diabetes and non-insulin dependent diabetes. In insulin-dependent diabetes, that occurs in approximately 5 to 10% of all individuals who have diabetes, so it's a pretty small number. In those individuals, the pancreas is not producing enough insulin. It's part of one of the body's autoimmune disorders in which the immune system is attacking the pancreas for whatever reason. We don't know why that occurs, but we suspect that it could be due to conditions such as a virus or an injury to the pancreas itself. There's no cure for that type of diabetes, but if you adhere to a correct diet and activity, that you can extend out the length of that disease and decrease some of the long-term outcome or long-term complications. There are several patients that have non-insulin type diabetes. In fact, it occurs in probably about 90 to 95% of all individuals that have diabetes. It tends to occur in individuals that are greater than 40 years of age, but can occur even younger than that. And so we encourage that individual get screening at younger age as well, particularly if they have family history of diabetes. In non-insulin dependent diabetes, what happens is the pancreas is producing enough insulin, but the body is not able to utilize that insulin correctly in order to decrease the sugar in our blood. As non-insulin dependent diabetes progresses, the pancreas can decrease the amount of insulin it produces, so then you can eventually have to require insulin to treat that diabetes. We see it most commonly in individuals who have other family members with diabetes. Those women that had gestational diabetes, they are at risk for having that non-insulin dependent diabetes later in their life. We also see it in individuals who have high blood pressure, high cholesterol, or who are overweight. They have a high risk of developing non-insulin dependent diabetes. In both types of diabetes, the complications are about the same. First and foremost is the cardiovascular types of complications in which the blood vessels become tight and clogged with that sugar. And so therefore you're at risk for having heart attacks because the heart is not getting enough blood, as well as strokes because the brain doesn't get enough blood. Also can affect our feet because the vessels going down to our feet may not be giving enough blood into that. So it can lead to ulcers or amputations of body parts. They can have problems with their kidney because there's not enough blood going there as well, and so they can end up with dialysis. Have complications of not enough blood going to our eyes and can lead to blindness as the disease progresses. Generally, many people, particularly in non-insulin diabetes, never know that they have diabetes until they receive some type of screening test. But in some people, they do have symptoms. Generally, we'll see symptoms such as fatigue, excessive thirst, increased urination, increased appetite, but they're losing weight, blurred vision. If you have those types of symptoms, then you should consider having your sugar checked. If you begin to have some of those signs and symptoms, it's really important that you come and see your family physician so that they can ask you some questions about those symptoms and then do some lab work. Generally, we do take some blood as well as your urine to check you for sugar in them. If they are borderline elevated or even positive, sometimes a physician may ask you to do special glucose tolerances test in which we give you some sugar and see how your body responds and see if you produce enough insulin to cover the sugar that we give you. We also will sometimes do a test that's called a hemoglobin A1C. This test helps give us an idea of what your sugars have been like over the past 2 to 3 months. In insulin-dependent diabetes, there is no prevention. It will happen if it's going to happen. But in non-insulin type diabetes, well, we can prevent that by controlling our weight, exercising on a daily basis, and adjusting our diets and trying to decrease the amounts of food that we take in order to not become overweight. If you are unable to come in and see your family physician and you are having some of those signs and symptoms, you can come to the laboratory or wellness program here at Palo Alto County Hospital and get a screening done through that program at a much lower cost. In insulin-dependent diabetes, often the treatment is insulin, which you take anywhere between 1 and several doses of insulin each day, depending on how severe your diabetes is. Other portions for treatment of diabetes is appropriate diet, and oftentimes we'll get you involved with seeing a dietitian. We have a specific dietitians here that can help teach you about diabetes as well as help you with a plan that you can do at home for your changes in your diet. Also, when we encourage exercise, and your physician should help to create a plan for exercising on a daily basis as well. We talk about treatment of high blood pressure and high cholesterol, as those conditions are often associated with diabetes, as well as working on weight control. In non-insulin dependent diabetes, we'll also continue to work on your diet, exercise, weight control, but oftentimes we're able to utilize oral anti-diabetic medications up to several years until the pancreas begins decreasing its production of insulin. Then you may require insulin late in its disease course. With good adherence to diet and exercise and weight control and monitoring your blood sugars at home and having good follow-up with your physician, it can be very well controlled, and the long-term complications can be extended for many years before you will see some of those complications. This is Dr. Jennifer Boevers with Living Well.